Those summer sports camps just around the corner. And before your young athlete hits the field, there are a couple of things they should do to prevent ACL injuries. So here to break it all down for us is Dr. Brian Cole, an orthopedic surgeon at Midwest Orthopaedics at Rush. Thanks for coming in this morning.
Thank you for having me.
Yep, the season's about to start, right?
Yes,
and,
it is.
And I'm sure as a doctor, orthopedic surgeon, this is one of your concerns. So what are some of the biggest injuries we see?
Well, you know, ACL injuries are the anterior cruciate ligament, which is a ligament in the center of the knee. That
okay, is that
I can show you if you wish.
Yeah,
you know,
I do wish.
So that's a ligament that's in the middle of the knee that actually connects the shin bone to the thigh bone. Okay.
So if we turn this around so we can show, and it's right here.
Right in the center.
Okay.
So,
and this is something that we actually see often. Let's do it again now that the camera's on there.
Good.
This is something that we actually see very commonly in sports, and for some reason it seems to hit girls more, right?
Yes. So there's been almost an epidemic on this. There's been a rise to 400 to 500,000 ACL injuries a year now, and part of it in girls and young women is that they have more access to sports. They're getting stronger, more fit, many times doing overlapping sports, not getting a break, and because of all the opportunity to participate, the incidence in girls has risen 5 to 7 times over the last 5 years. In fact, ACL injuries in general have risen significantly. We're seeing at Midwest Orthopaedics 2 times the number of ACL injuries now than we did 5 years ago, and maybe 7 times over the last 10 years. So there's been a significant rise, largely due to participation in sports.
And this is not a good thing because a recent study showed that these injuries can lead to problems later in life. Tell us about that.
Yes, so one of the reasons we place so much emphasis on prevention, and I'll just make sure I don't forget, there's a great website called kneesforlife.org where we've partnered with the IATA, the Illinois Athletic Trainers Association. And here you can learn this program. Very tough to teach on a segment like this, but it's critical to know that ACL injuries can be reduced significantly, sometimes between 1/3 and 70% by participating in a 15-minute program before practice or play.
And which you're going to show us, but the reason why obviously you don't want to have any injuries, but I recall reading the study that's saying later on if this happens to you, you could have arthritis issues, right?
Yes, there's a recent study that has shown that at 5 to 10 years there's a significant proportion of patients who had a previous ACL injury can end up developing arthritis downstream.
Wow, okay, so that's definitely something that you want to prevent. So talk about prevention. We have the cutest little model that you brought with us this morning. Her name is Ava, and maybe if Ava's going to demonstrate, so why don't you walk through, Ava, listen to what the doctor has to say and demonstrate for us.
So this would be part of one program, and it's a 15-minute exercise regimen that you would do before practice of play. And it generally begins with a warm-up, which could be running up the field and down the field, for example. And then it goes into some type of strengthening exercises, which could be sort of a walking lunge. So I don't know if you want to show Ava. She could show you a walking lunge as a strengthening exercise.
So this is something that you are encouraging all youngsters like Ava and really all athletes to try to do before. And you said
correct.
15 minutes before they actually start playing. So there's the walking lunge. What's the next thing?
Then the next thing might be something called plyometrics. Now, plyometrics is an activity where there's aggressive muscle contraction over a short period of time. So examples of that could be a double leg hop. So Ava, show us how you would do a double leg hop. And there you go, side to side. And she's landing on her toes, and she's landing with a little bit of hip and knee flexion, both of which are otherwise risk factors for ACL tears. So girls tend to land more stiff-kneed and stiff-hipped and on their heels. If you can get them to train to land on their toes with a little bit of hip and knee flexion, that can make a difference. So yeah, so show, when she was doing that jump, what is that doing for her as far as stretching? So rather than stretching, it's getting her muscles to warm up and to improve her mechanics that if they're faulty may lead to ACL injury. They transfer the forces to the ligament or to the ACL.
Okay, and then what's the next one?
So Ava, show a double leg where you jump, just a simple double leg jump up. Now when she does this, her feet are shoulder width apart, her generally facing forward, and she's landing on her toes, soft landing, and she lands with a little bit of hip and knee flexion. So this would be another type of what we call plyometric. Very nice. And then scissors lunge is another one. So that kind of thing. So and what's the website again that people can So we have 2 wonderful websites, one of which helps prevent throwing injuries because we're seeing a number of those. That's shouldersforlife.org, and then we have kneesforlife.org, both of which have a variety of exercises and prevention programs where you can learn learn how to minimize the chance of having these sometimes devastating injuries.
Okay, great tips for everybody. Thanks so much for coming in.
It's a pleasure to meet you,
and I think a lot of parents should be going to this website because the season's about to kick off, and we definitely want to prevent these injuries from happening. So thanks again for coming in.